Let's create a care plan for an in-network or Medicare patient where the deductible has been met and there are benefits payable. There's going to be two ways to handle this. Let's start with the first one. So here we're going to go ahead and input the number of units and the codes we're going to use as if this was a Blue Cross Blue Shield patient. So the first thing we're going to do is we're going to put in number of units. Let's do an exam. Let's do 1 unit of an exam, and we're going to use Blue Cross Blue Shield's fee schedule here. So let's put in BCBS, and you'll see all the BCBS codes will show up here. So let's say exam 99201, we use Blue Cross Blue Shield's fee, and then we're going to go ahead and put in, let's say 24 units, let's say BCBS adjustment. As you can see, it uses Blue Cross Blue Shield's fee because you created it that way. And then let's do 1 re-exam on the way out. So now, as you see over on the right-hand side, we have this entire care plan all dealt with. Now, if we're going to deal with this and the benefits are payable, the first way to handle this is to say, okay, the patient has a $500 max payout per year. So if the deductible has been met, and we're going to bill out whatever we bill out as far as our billing system is concerned, but what is allowed, we have $915 of allowed services. So we could actually put in here that we estimate that we're going to have $500 in insurance reimbursement, which leaves us with $415 balance. The patient's going to go ahead and pay $100 today. Now that leaves us with $315 of a balance, and we're going to do 2 payments over the course of 2 months now. So let's put a processing recurring payment of every 30 days, starting on the 1st, and 2 recurring payments. When that happens, now we have the math already completed for us. So when we hit print and charge, today's payment will be $100 and the system will automatically charge that. And then on the 1st for the next 30 days, we're going to have 2 payments, one each of $157.50 every 30 days. The second way we can handle this is by also creating a care plan based upon how much the copay is going to be. So if the patient has met their entire deductible and they're only going to be responsible for the copay for the next 30 visits, then the easiest way to handle this is to just put in exactly what their copay would be for that service. So let's go ahead and create this care plan using just the copay amounts. So here you go ahead and you put down, let's say units, and let's put code, let's put BCBS, and we have our exam with just the copay, and we're going to go ahead and add, let's go ahead and put 24 visits of an adjustment, let's put BCBS here, and we're going to do just our copay for the adjustments, and we're going to put add, and let's do 1 re-eval to go ahead and do a discharge summary, and we put BCBS, and we have our re-exam right there with our copay amount. So once this is done, this may look a little bit easier for the patient to understand than not having to do math, because now it lays out exactly what their copay would be only. So you'd have $183 out of pocket for the patient. So if you put in $183, it automatically sets up one time. You go ahead and hit print and charge, and it'll charge the patient $183 today. Now, if you wanted to change that and say the patient's going to put down $50 today and then do recurring every 30 days on the 1st, 2 installments, you'd have 2 installments of $66.50. Once again, once you hit print and charge, we'll go ahead and print it with just the summary. And when we print that, it's all ready to go. If this is done on an iPad, all the patient has to do is use their finger, and they can sign it here, and the staff signs it here, and we're all set. If not, you go ahead and print it to paper, and the patient would sign it, and the staff would sign it, and you keep it in the file.